Hi, my name is Dr. Heather Caton. I'm a therapeutic optometrist as well as optometric glaucoma specialist. The name of my practice is Ocular Heaven. We're located in Frisco, Texas. Our hours of operation are Monday through Friday, 8 to 5, and Saturdays, 10 to 2. We have 2 doctors on staff, and we work 5 days a week and alternate which Saturdays we work. Our practice is privately owned, and we do also have our own privately owned optical. Let's see. Our primary care practice specializes in contact lens fitting, as well as vision therapy, glaucoma management, and pre- and post-surgery management. This procedure and policy manual is used to ensure efficient operation of the practice, Ocular Heaven. Its main goal is to train new employees, educate on policies and procedures of their specific duties, as well as to serve as a reference for all staff members. The office manual should also aid in preventing liability exposure. If any updates to our manual occur, all employees are held liable and should know any changes or amendments that we've had to our manual. We are always open to new revisions, and we are doing these revisions to make sure that we have improved staff training constantly, as well as excellent patient care. The points of our discussion today are 3 things: paid time off, dress code, and sanitation. Paid time off, the first thing we'll talk about is maternity leave. I know we'll have a lot of ladies on our staff, so this is most important, so make sure you listen up here. First, we'll talk about statutory maternity leave, which is 8 weeks of paid time off to be with your child. The earliest that one can leave is 11 weeks before childbirth. And we also ensure that the employee will not come back until 2 weeks after childbirth, so you have time with your little one. We'll also discuss statutory maternity pay. So you will be paid for the first 6 weeks 90% of your average earnings, as well as the last 8 weeks 80% of the weekly earnings. Next, we'll talk about vacation time. You'll have 10 paid business days per year. You'll also have 10 paid holidays, which include Labor Day, Christmas, New Year's, and Memorial Day. You'll also have 2 personal days and 8 sick days. With the sick days, we ensure that we have a doctor's note so that we know why you were excused from the office. Anything over 8 days will be discussed with our office manager to see if that was professional. The next thing we'll talk about is dress code. Doctors will have business professional attire and up to their discretion of what is important and appropriate in front of the patient and for patient-doctor interaction. For our scribes and technicians, we'll have colored scrubs. They'll have a different colored scrub per day, and they'll get to choose which one they would like as long as they are all coordinated. We'll have the front desk wear solid polos, and they can choose which color polo that they wear per day as long as they match, with black dress pants or appropriate skirts. And our opticians will wear 2-toned colored polos as well, and they will be paired with black or navy dress pants. Sanitation. One of the most important parts of a good and healthy, thriving practice. We want to make sure that all of our rooms are nice and clean, and it appears that we are put together for all of our patients. So here in our room, before we have any patients brought back, we want to make sure that our phoropter is clean. We want to make sure that our slit lamp is clean as well, the chin and the forehead rest, and the tonometry tip. Anything that comes into contact with the patient, we would like to be clean. Next, we want to talk about the organization of the room. We do not want chaos just like this, or any beverages in the room because they may tip. We will leave those in the lunchroom. We want to make sure that everything looks great. Thank you so much for spending the time to listen to our manual here at Ocular Heaven.